The Health Ministry in Zimbabwe has announced 2 cases of Mpox disease. The country's Health Minister Douglas Mombeshora says the 2 patients have been isolated. The first case was recorded in Harare, while the second was recorded in Mberengwa, Midlands province. In both cases, the patients have no history of traveling, traveling back to Zimbabwe in September.
The Minister of Health and Child Care wishes to inform the nation that Zimbabwe now has 2 confirmed cases of Mpox, one in Harare and another in Mberengwa. Both cases are in isolation at home and are receiving appropriate care. Both cases are stable and recovering. Mpox, which is formerly known as monkeypox, was declared a public health emergency of continental security by Africa Center for Disease Control on the 13th of August 2024. It was then declared a public health emergency of international concern under the International Health Regulations of 2005 by the World Health Organization, WHO, on the 14th of August 2024. In Africa, there are 7,535 confirmed cumulative cases of Mpox and 32 deaths reported so far in 2024. Here in Zimbabwe, we have 2 cases. Case number 1 is an 11-year-old male child with a known history of having traveled to South Africa in August 2024, returning to Zimbabwe on the 10th of September 2024. He developed symptoms on the 23rd of September. He is currently in isolation at home and is no longer infectious. 7 contacts have since been identified and are being monitored. The second case is a 24-year-old male with a known history of having traveled to Tanzania on the 14th of September 2024 and came back on the 21st of September 2024. He developed symptoms on the 29th of September. He is currently in isolation at home and is no longer infectious. Contact tracing and monitoring is underway.